What happens between a therapist and their patient is both private and profound. Catherine Gildener was a clinical psychologist for more than 25 years. In her new book, Good Morning Monster, she lets the rest of us in on the recovery of a few patients who she calls heroic. She is the author of one novel and 3 memoirs. And Catherine Gildener joins us now. Hi.
Hi.
It's nice to meet you. This book hit me in the gut.
Oh, great.
Some of the stories stuck with me. Actually, all the stories stuck with me for days.
Oh.
But on your Twitter handle, you call yourself, and I quote, moldy psychologist turned ripe writer. What do you mean by that?
I mean that I was a psychologist until I was 50, and then I decided to be a writer. So I was already 50 when I started writing. So anybody out there in the audience who says, I'm too old to do this, right? I didn't start.
You're never too old.
I started at 50, and it was okay.
Why the change? What made you want to become a writer?
I had heard stories from my patients for 25 years, and then I realized I had a story to tell. And I wanted to tell my story, which you couldn't do as a psychologist. So that's why.
Well, let's look at some of the remarkable people that you profile in this book. It's 5 of them. The first one, who happens to be your very first patient as a psychologist, is Laura. Can you give us a brief background of her story?
Laura came to me from a GP, and she had a lot of stress. But she didn't have any idea what the word stress meant. Her mother had died when she was 6, and then she had a stepmother who died as well, both under strange circumstances, which
Involved her father.
Could have.
Could have.
We don't know that for sure, but they were both strange deaths. So then the father parented her and her brother and her sister. And then he was on the lam for something he'd done or borrowed money, and they moved up north into near Halliburton at a cottage. And right when the winter was beginning, he went out to get cigarettes, and he didn't come back.
And Laura managed to take care of her. She was 9, and her siblings 6.
She was 8 and then turned 9,
Okay.
and she had a sibling who was 7 and one who was 5.
And remarkably, she managed to take care of them for 6 months.
Until April.
Until April. Remarkable.
Yeah.
And in the book, you speak about the 5 patients, and you call them heroes. So what made Laura heroic?
What made her heroic in my eyes is that she had incredible resilience. She never cried over spilt milk. That was not her MO at all. Right? So what happened was she went out and stole clothes, she went out and stole food, and she left little tiny notes saying what she had taken, so as she was an adult, she could return them. I know, it's very touching. She brought those in, and they're, in this little child's handwriting, right? And she thought that she was 8, she was old enough to deal with all this. And she did deal with physical things very well. But then they began to fail psychologically, like the brother bedwet, and the sister was crying all the time. She had no idea how to parent, so she would just threaten them, like, if you guys don't stop, I'm leaving, that kind of thing. This kind of thing the father would say, right? So she had no idea how to do it. So she turned on the TV one day. They only got World of Disney and MASH. Do you know the show MASH?
MASH, yes.
Yeah.
Yep.
Okay, so on that show, there was a guy, Colonel Potter. And Colonel Potter was one of these nice, kind Midwestern doctors who, never had a neurotic moment, and was talking to Radar, the young boy who was a soldier. And he did this every show. He would talk to Radar. And she started listening, and she started saying, I could do that. I could talk like Colonel Potter. I could say those things, just like he says to Radar, we'll all go home someday, don't worry, this is just temporary. All the things that he said. So she began watching him, and then she tried that with her brother and sister.
At 8 and 9.
At 8,
It's
and
incredible.
it worked incredibly well,
Yeah.
because, she, about the bedwetting, she didn't threaten him, but just said, this is just temporary, we're
And
all
he
going to go
eventually
home.
stopped,
Yeah.
yeah.
And he stopped, and everyone seemed to get better. But I totally admired that. I mean, when you think about resilience, she reached into the television and pulled a father out. And then, he became a father figure for her whole life. She actually became very successful as an adult. And
how would you define successful? Like, would you define her life now successful?
Yes, she married a really wonderful person. They've been very financially successful. She started all kinds of charities.
And she had children as well.
And she had children as well, and they've all done very well. And so she's been quite happy.
What does Laura's story teach us about the human spirit?
Just keep going and do not say, okay, we have to give up. Because she thought of giving up and going to the authorities, but she knew they'd all go to foster care, right? Which did eventually happen, right?
You have another patient by the name of Danny. Could you read this section off from the book? And this is an exchange between Danny and you. Danny is an Indigenous man whose wife and child were killed in a car accident, and then his boss asked you to see him.
Because he didn't mourn. He said he's not mourning.
He went back to work.
He went to work the next day and never said a word. So then he was sent to me. Week by week, a few things would come out. I tried to simply be a witness. I decided not to ask about his wife or child or his lack of mourning. If he never consciously felt pain, no wonder he didn't mourn. At one point, though, I did say this: people who don't feel pain can't feel joy. He made eye contact with me for the first time and said, I can live without joy. Do you think there's no pain in your heart? Or are you saying you have it locked away? I ventured. He said nothing more. But a week later, he came in, sat down, as though we were still having the same conversation, and said, it's locked away.
How did you go about peeling away the emotional layers with Danny?
It was difficult because Danny did not talk. And when he came in, and sometimes weeks would go by and he wouldn't say anything in therapy, right? And I had him for 5 years. So by the end, we would talk about the beginning. And he thought he was getting to know me. And I thought, I'm not doing the job, right? So we were both having different feelings. And he, he wasn't the least bit uncomfortable with the silence. And he always made the appointment. And he was a truck driver who drove across Canada. So he had to make elaborate plans to be in my office at a certain time each week. So finally, I decided to just ask him. His parents were trappers, one of the last trappers from his tribe. He was a Cree. And so I finally decided to just talk to him about trapping and what it was like to, live in the woods and, So he began to talk just about that. We didn't talk about anything emotional for about 4 or 5 months. I mean, I know everything about trapping. If there's anything you want to know about trapping, right? So, and then, slowly, but I mean, I'm saying sometimes we would only have 15 minutes worth of conversation,
But eventually you find out that he went to residential school.
I find out that he went to residential school at 5 years old. He was 2 men came through the forest and said to his parents, you may not raise your children as, they were called Indians then, you may not raise your children as an Indian anymore. The government is stepping in. And the parents didn't understand English, so they had no idea. And, Danny says the only thing he remembers about the 2 men is that they had leather shoes in the snow. That's all he remembered.
And it didn't make sense for him.
Yeah, he just thought that is strange, right?
Yeah.
So then he was taken thousands of miles away, and he didn't go back home till he was 18.
What was missing for Danny in your training as a psychologist?
Oh, well, I knew that things were, first of all, I went to residential school, and I'm white, and I'm part of that whole process. I mean, it wasn't my decision, but I'm part of that process. And I mean, how could he really trust me, right? We had all of those issues. Plus, I found he has, natives and indigenous people, I've seen a lot of them now, are very different psychologically, completely different, have animal dreams, all kinds of very different things. And I realized it's not really like Sigmund Freud saw, Jewish neurotic women and wrote his theory, right? Well, what if he'd seen, indigenous people like Danny? He'd have a different theory, So I began looking for indigenous healers. And this goes back 35 years, right? This is when people hadn't even heard of residential school, right? So I finally found one at Harvard in the US, couldn't find anybody here, and Dr. Brandt. And he and I'd like to actually do a book on this. He and I exchanged hundreds of letters, and he was so kind to me. And he said, you can cure him in the white way. Go ahead and cure him, which I did. Like eventually he could express his feelings. Eventually he could say at work, do not call me that name, I don't like it. Like he learned how to get his feelings out, and he learned boundaries, how to say, you can't do this to me. And that's what white therapy is good at, right? But
You helped him reconnect with his background
Yes. Well, that was the hard part. He didn't want to reconnect with his background.
because it was a trigger for him.
It was a total trigger because he was, one time he saw his sister far away in another field. She was at the girls' part of the school, and he screamed, Tanisi, Tanisi, which is hello. And the priest said, don't ever speak in a native language again. And he went, Tanisi, again, because he was so excited to see her. And he was in a hospital for 3 weeks, beaten to a pulp. So he...
And this is when he was 5, 6.
He was like
child.
6, and he never spoke another word of Cree. And Cree really caused him to feel dizzy, weak, and he would break out into a sweat. So he said, I don't want to go back to be a native. Everything about it is terrifying. Do you know that they made him confess in confessionals that he was a native every Saturday?
That was his sin.
That was his sin, right? So it worked perfectly. He didn't want to go back to being a native. But what he didn't work perfectly is he wasn't white. So he didn't have a culture. And I had a lot of trouble trying to get him to go back to this. And I kept writing to Dr. Brandt, and he said, try smudging. I went and I did the smudging. I did the sweat lodges. I did all of these things. And I was amazed at how warm the community was. I said, this is what I'm doing. And they said, come on up. We'll show you what we do. You can do a sweat lodge. So I learned a lot.
And you helped him reconnect to his foundation.
That's right. And oddly enough, my office is 1 block away from the Native Center. So he walked by one time and he saw that the library was called in Cree. It said local library, and it's a long Cree word. And he saw it, and he actually was able to read it. And then he walked in and he said, I'm going to do this. I'm going to take this language. I'm going to learn how to do this.
Yeah.
But they had to practically carry him out the first time. I mean, he just went in and he broke into a sweat.
The other person that I want to talk to you is about from the book, because there's 5 people.
Right.
The third one we want to talk about is Madeline. Can you tell us her story?
Madeline was referred to me by her father. I had seen him for some kind of marriage counseling a long time before that. And she is very, very wealthy, one of the wealthiest people in Canada. And this goes back to the 1950s. Her mother married her father. This is when fathers were, rich people were written up in the society pages. We'll spend summer in Nantucket. So a gold-digging woman who wanted to marry him, went to that place and met him, and she's very beautiful, and sure enough, they married.
And then they had Madeline.
And then she didn't want any children, but then he said, well, what am I going to do with all my money? And she said, I'll spend it. And they said, so they had 1 child, Madeline. And the mother absolutely did not have any idea how to parent.
And the title of your book comes from her
Yeah,
story.
every single morning she would come down the stairs, and her mother would say, good morning, monster. And one time she said to her mother, but I don't understand. What she tried to do to make her life work was to be perfect. So she went to private school, and she was head girl, and she went to LSE, and she did everything perfectly, was on the tennis team. And she would say to her mother, why does everyone like me but you? And she said, because only a mother knows a monster. A mother knows her child, and her mother knows when her child is a monster.
So no matter what she did, she just was never good enough. Why do you think her situation might have been more dire than Laura's?
It's really shocking what happens with people think, when you're wealthy, you have all of the services you would want. But that's absolutely the opposite. I mean, what happened was her parents went to Russia, and her mother forgot to get a babysitter when she was 11.
For 6 weeks.
For 6 weeks. So the power went out, and they have alarm systems all over. So the police came, and the alarm people came and saw that she was alone.
But the police, I guess, assumed that...
No, the police said, wow, well, I think the police unconsciously, I don't think it's conscious, unconsciously said, these people are really rich and they give lots of money to hospitals. They can't be bad people. And I think if we report him, we could get in trouble. Let's get out of here. So they left not doing a thing and left her for her last 3 weeks. At least when Laura was found, she was sent to foster care. They said, oh, okay, we have to handle this situation. But when somebody's wealthy, everything going for them in an exterior way, you don't know what hell they're living through.
Well, a line that stuck with me from the book is that you write is that therapy isn't getting to the truth. If it is not about getting to the truth, then what is it about?
Therapy is about learning coping techniques. And the more you, and it's also about helping you get rid of your defenses, which we start building up as tiny children. And you can't get at any truth about yourself if you just have layers and layers and layers of defenses, right? So if you can pull this defense away and this one, and then you kind of get into, wow, this is what I'm really frightened of. This is, like with example with Danny, he had, all kinds of sexual abuse. And I said, we talked a lot about that. And he said, that wasn't the worst thing. The worst thing was incredible loneliness. And that's why he never talked to people after that. He just thought, I can't commit to people ever, because if I do, they'll all be taken away from me someday. I can't commit. And of course, that made him even more lonely as an adult. That's why he was like a frozen brick of ice. So when his wife and child died, he was like, well, they're gone.
Right. It's another thing that's happened.
Another thing that's happened. That's right.
In the first chapter of your book, you write about your practice, and you write this. I was learning a lot about the ad hoc nature of therapy. Before entering private practice, I'd had no idea how many theoretical deviations were required to keep up with a patient.
Yeah.
I was quickly realizing that theoretical purity was strictly an academic extravagance.
Right.
As a psychologist, I would use any weapon from whatever discipline I could
That's right.
find. Yet, even with the necessary intellectual training, at the practical level, I sometimes struggled. How did you struggle?
When I first started out, I said, I think I'm going to be a Freudian. So, and I think I'll collect a history, because everybody collects a history. And you learn you spend ages learning how to take a history from a patient as soon as they come in the door, and we all learn we have to do that, and we watch through one-way mirrors, and we do all of that. But, Laura, for example, walked in and I said, I'd like to do a history, and she said, no way. I'm not talking about those village idiots. I'm not doing that. And so I thought, wow, even when I worked at Lakeshore Psychiatric, someone said to me, I am the Virgin Mary, and I said, where are you from? And she said, Nazareth. I got a history, right? So, but I had to learn, you've got to roll with the punches. Some people, it doesn't look that way when you're in school. So you have to find ways to insert that theory. But if that theory doesn't work, you have to try another one.
Because you want them to come back.
You want to reel them back in, but like if you can say, okay, I'll try Freud. I think Jung is tremendously interesting, but he doesn't work for therapy for me. You can become more enlightened about yourself, but it doesn't help you get rid of your anxiety, and that's what people are there for.
One thing that I thought was really interesting is that you also write about the mistakes you made as a therapist.
Oh,
what did you learn about yourself from those mistakes?
Oh, well, did I? I learned that even though, everybody that's a therapist has to have their own therapy, just so that you don't make all kinds of mistakes based on your own unconscious stuff, right? But here's a perfect example is my editor at Penguin said, you let Madeline's father off the hook all the time. When I was reading that, you were always, and he didn't really parent her. He let that awful mother control her. Two of them hid in the basement when she would slash the furniture, right? And she slashed the furniture because he said she didn't need redecorating, and then she slashed it, and then she said, well, now we do, right? So, but he didn't really take care of her. And I actually realized through this editor that I should really look at why I let him off the hook. And when
Did you find out?
Yeah. I realized that he reminded me very, very much of my father, right? And my father, at a young age, had a brain tumor and lost everything. But there was a time when he was very, very successful. And so I lost him when I was a teenager. But I remember he was a lot like her father. And I wanted that image of my father at the age when he was competent. And they looked alike. So I thought, wow, the editor was pointing out, yeah, I let him off. So I went to a therapist and I talked about it. And I said, that's what I did. And I figured out why I did it.
I think we have this assumption that therapists are all-knowing. And,
yeah, no, not true. No, not true.
Our final question, because we've run out of time, unfortunately. But, these stories are, it's incredible to find out how much the human spirit can endure.
Shocking.
How do you manage the emotional toll? Because your job is to help people navigate that. How do you manage the emotional toll?
I look at it as an intellectual puzzle and not an emotional one. Some of them are very sad, but I always say, okay, I've got a puzzle here. How am I going to solve it? Or a mystery. Okay, this isn't what's causing it. Is this? And as long as you keep looking at it in an intellectual way, you don't become involved. occasionally things happen, like the father that looked like my father, that kind of things, you get pulled in. But I try really hard not to do that. I think because I also worked for my father when I was a little girl from the age of 4 till 12, delivering medications. And because he owned a drugstore. So I would often say, oh, these people are dying of cancer and they're sad and they're all alone when I gave them the medication. My father would say, we've got a whole day's work. We got to go. We've got to drop off all these medications. You can't stay with them. It's unfortunate. So I think I learned to compartmentalize really young age, just to say, okay, this is my job. This is my job. This isn't my job.
And I guess it's what we do for all of us to cope with whatever it is that we're dealing with.
That's right.
Catherine, thank you so much for being here. This book is incredible.
Thank
you. It gives us a lot of perspective.
Thanks, Nam.
And that was Catherine Gildiner, and the author of Good Morning Monster. Thank you.
Thank you.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.